Hello, my name is Ian Shaughnessy and I will be discussing how the Affordable Care Act, also known as Obamacare or the ACA, has impacted the access to health care, the cost required for access, and the quality of medical services for Americans. My group and I have put together the following presentation in order to provide a clearer picture of what the Affordable Care Act does. To begin, the Affordable Care Act has impacted millions of lives and continues to do so to this day. Since 2010, the ACA has dominated the political arena by creating a controversial platform of government-controlled or regulated health insurance guidelines that states, employers, and individuals must adopt or be fined. While there has been much talk about the ACA, a thorough review of what it has done to increase access through sustainable means with increased quality of care will prove that it has been successful. In short, the ACA is a long piece of complex legislation that reforms the United States healthcare system by increasing accessibility and curbing healthcare spending. During the following presentation, a thorough review of what the ACA has done will reveal that it is a good law that enables an improved healthcare system. The first area we will cover is how the ACA impacted access. When the ACA was put into effect, there were specific guidelines set for the states to follow in terms of coverage. Mandatory eligibility groups include low-income families, pregnant women and children, and those individuals receiving Social Security benefits. These individuals were below 138% of the federal poverty level. The financial determination for pregnant women, parents, children, and adults fall under the tax income and filing relationship. Individuals with disabilities or are age 65 and older are determined based on the Social Security Administration program. States have been given the option to expand their coverage to low-income adults that are at or below 133% of the federal poverty level. Several states have not done so, but may choose to expand at any time. The ACA, in addition to expanding healthcare coverage, has also mandated that every individual must either maintain a minimum essential coverage throughout the year with a particular insurance plan, get an exemption or pay a monthly penalty fee. For independent individuals who do not have employer-sponsored insurance and choose not to buy private insurance, the ACA has implemented state-specific health insurance exchanges, also known as marketplaces. These marketplaces are online price comparison websites where consumers can purchase health insurance that counts as minimum essential coverage, receives federal subsidies, and would also be granted exemptions. All marketplace plans must offer 10 essential benefits with no lifetime or annual dollar limits, include free preventative services and an annual wellness visit, have at least 60% actuarial value, capped deductibles, and out-of-pocket expenses. Ultimate purpose of marketplaces has been to provide options and incentives for younger and a healthier population to buy insurance to offset the high premiums established by the elderly and diseased population. Upon the enactment of the ACA, states were either early adopters, pragmatists, or passive or active resistors. Early adopters were the blue states or the Democratic states that moved quickly to establish a state-run exchange in time. Some states took a pragmatic approach and tried to keep their options open by accepting the federal grant but not doing anything about it. While other states, especially red or Republican states, were either passively or actively resisting ACA by rejecting the federal grant provided. Passive resistors returned the federal grant and passively opposed the ACA, whereas active resistors not only returned the grant, but were also very vocal and active in regards to their opposition. Listed are the different types of exchanges and the states that adopted them. All 50 states currently fall into the 3 different categories listed to include Washington, D.C. For additional information on exchanges, refer to the given websites. Medicaid expansion under the ACA experienced large increases in enrollment. The Patient Protection and Affordable Act and the Healthcare and Education Reconciliation Act of 2010 together expanded the coverage for Medicaid to millions of low-income Americans and makes numerous improvements to both Medicaid and the Children's Health Insurance Program, known as CHIP. The ACA improved access to millions of Americans. However, the most vulnerable population still remains at risk of not being able to access care. Through Medicaid expansion, vulnerable Americans will get the treatment they need. For people who cannot afford private insurance, Medicaid continues to be available. The ACA has provisions for states to expand Medicaid coverage to ensure it reaches more people. People with disabilities are eligible for Medicaid based on their low income status. There are benefit packages for people with disabilities. It is important to understand how the ACA is impacting Medicaid. In 2014, Medicaid and CHIP enrollment increased by more than 4.8 million people and continues to grow. The ACA has positive impact on Medicaid and CHIP enrollment in the states that have implemented the Medicaid expansion. These major changes that would lead to increased Medicaid coverage at the same time reduce the number of uninsured Americans. The ACA provides quality care for the poor, uninsured citizens of the United States by specifically expanding Medicaid to low-income adults, modernizing and simplifying the enrollment process, and drastically increasing outreach and enrollment efforts. All of these changes have effectively helped decrease the number of uninsured adults across the United States and allows more people to experience a sense of freedom knowing that they have coverage. Under the federal poverty level, the ACA limits how much a middle-income family or individual can spend to buy insurance. This is determined by a percentage of income. Under the ACA, plans sold on the state exchange are based on the coverage of the plan that the policyholder can pay for. There are 4 levels of plans: Platinum, Gold, Silver, and Bronze. The Platinum plan covers the most, but has a higher premium. The ACA includes provisions for eligibility that fills in current gaps of coverage for the poorest Americans by creating a minimum Medicaid income eligibility level across the country. The ACA provides many benefits to people newly eligible for Medicaid by providing a benefit or benchmark equivalent package that includes the minimum essential benefits provided in the Affordable Insurance Exchange outlined on Medicaid.gov. Due to these benefits, there are several variables that come into play in the political debate on the ACA. First, the ACA provides subsidies to people that qualify in order to make it more affordable. Second, it emphasizes preventive care by covering more prevention procedures. And third, the ACA promotes finding innovative ways to deliver health care by implementing technology and home-based care designed to streamline processes to make healthcare more efficient and less expensive. The political players hold different positions for and against the ACA. Proponents against the ACA use the 10th Amendment of the United States Constitution to argue the Commerce Clause and congressional authority based on legality and constitutionality of the individual mandate, which requires individuals to maintain health insurance coverage or may have to pay a penalty for each month of non-compliance. Given the fragmentation of the healthcare system delivery of care, quality, cost, and access are impacted. It makes delivery of high-quality care harder, if not impossible. Overall, the financing of the ACA has been a political bone of contention. The ACA is a complex law that is difficult to fully understand. Implementation requires increasing access and quality of care while attempting to not impact cost. As insurance premiums increase, cost of care greatly impacts individuals, businesses, and families, especially low-income individuals and families. Repeal of the ACA has been in play in the political circles, which directly affects the uncertain future of the ACA. While political players and healthcare policymakers continue to argue the sustainability and viability of the ACA with new reforms, Henry Aaron from Brooks University stated, "These reforms will not give us a perfect healthcare system, just one that we can keep thinking with and improving on in order to ensure that the system offers quality care to almost everyone at sustainable cost," during the Conference on Equity and Choice in Healthcare Access in 2013. With only 26 out of 50 states opting to participate in the Medicaid expansion, there is room for improvement. The federal government has chosen to fund the first 3 years at 100% and 90% thereafter. If the states wish to open a provision or expansion, it will not be covered under the government spending allotment for the ACA. Examples of possible expansions include severely ill individuals who do not meet the financial eligibility requirement but have no coverage elsewhere. There was a thought of an expected decline in private insurance coverage. However, it is not dominant enough to show. There has been some confusion among those enrolled in the expansion programs. Individuals seem to not fully comprehend the do's and don'ts of the program. Specific policies such as making the first monthly contribution has resulted in them being disenrolled. States are seeing more individuals not fully aware of the monthly contributions required, as well as the payment issues, therefore hindering coverage and support. There are a total of 10 titles under the Patient Protection and Affordable Care Act. Title I, Quality Affordable Health Care for All Americans, contains information on benefits, rights, and protections, rules for employers and insurance companies, and other language around quality and affordable healthcare measures. This chart here goes into some of the provisions, with majority of them coming from Title I, that we think should stay under the healthcare reform. For instances, premium tax credits and cost-sharing reductions will assist the insured with the cost of health insurance premiums, which has been a complaint of the newly insured. And the small business tax credit provision gives employers a tax credit of up to 35% depending on the number of employees employed and the percentage contributed to the premium. Again, we want to keep provisions that will improve affordability for people, and this particular provision will increase the likelihood of small businesses that will participate in the market. Forcing Americans to purchase healthcare insurance does not have a drastic impact on the overall quality and affordability of healthcare. An article in the New York Times suggests that people that consider themselves to be overall healthy are less likely to buy insurance, which could drive up prices for those that need it most. However, with the help of subsidies and tax credits, there is no need to force those that don't want coverage to purchase it. In order to make the ACA more effective, there should be an establishment of the federal government's own public insurance in the exchanges to increase competition among private insurances, to help lower premiums, and to increase benefits and flexibility to the general public. Additional revisions should relocate financial incentives from employer-sponsored wellness programs to the insurance company-sponsored wellness programs in order to encourage individuals to seek preventive healthcare procedures. When considering the possible ramifications of repeal and replace, we must consider the following. A 40% reduction in the uninsured rate of 2014 and 2015 was due to the creation of premium subsidies for exchange coverage, and 60% was due to increased Medicaid coverage. Much of it the result of enrolling individuals eligible for Medicaid before 2014, including many children. As of late 2014, only one-third of this enrollment group was eligible for insurance pre-ACA. Since 2016 election, a significant doubt has been cast over the future of the ACA, with discussion of a full repeal or targeted changes to include elimination of the individual mandate, shifting Medicaid to block grants, and scaling back or elimination of premium tax credits. These changes would significantly reduce coverage previously gained. Repealing the ACA could affect gains of the Cures Act, which gave $200 million to serious mental disorders and $1 billion to opioid use disorder, effectively taking away billions of dollars used for the treatment of substance abuse and mental health disorders. The Cures Act provided opportunity to close an opioid treatment gap for approximately 420,000 people who indicated finances or lack of availability of treatment were reasons they could not receive it. Repeal also has the potential to lead individuals to prison and jail instead of treatment. It may also affect approximately 1.2 million people with serious mental health disorders, and 2.8 million people with substance use disorders would lose some or all of their insurance coverage. More ramifications of repeal and replace includes low, moderate income families will be forced to choose low-cost plans with higher deductibles, for example, catastrophic plans. The impact will be unclear until the family is faced with serious illness and obtains a $5,000 to $10,000 deductible cost. Uninsured individuals will ignore preventive care previously covered by insurance and will present to ERs for more costly care. Automatic coverage in ERs was mandated by the Emergency Medical Treatment Access and Labor Act passed by President Ronald Reagan in 1986. Unpaid medical bills have been documented and is the #1 reason for personal bankruptcy. Repealing the ACA would also stop covering approximately 20% of preventive measures that immediately lower healthcare costs and are guaranteed as part of ACA-compliant insurance plans. Employers presented with rising insurance prices for their plans will shift costs to workers through high deductibles and copays. Providers will revert to using fee-for-service reimbursement system rewarding quantity, not quality. Is the ACA law good or bad? From what was discussed here, the ACA law represents as a good law. According to the research and facts presented, the ACA has provided an excellent platform to continue to discuss healthcare reform throughout all aspects of our society. People are talking about possible solutions within their homes. Private industry is considering how to increase or even offer coverage, and our government is trying to figure out how to increase its effectiveness. The ACA has reduced the number of uninsured people in the United States by drastically increasing education and outreach programs in order to provide more access for everyone. Another important shift that the ACA began is one where healthcare providers are looking at preventive measures. Prevention is the key to future healthcare plans that are effective, and the ACA has provided our country with the future possibility of creating a government-funded universal healthcare plan that meets everyone's needs. The following slides cover the sources where the information was found to substantiate the findings. Thank you for watching this brief.